let's go ahead and dive into the best physical activity. So before I get onto the board really quick, this is by Dr. Barry Franklin and Robert Sweetgall. And they're from Harvard Medical School. The book, just in case you ever want to know, it's called One Heart, 2 Feet. One Heart, 2 Feet. And I'm going to be reading out of it verbatim, but just a small little brief part of it. So the best physical activities. Picture a runner, walker, biker, swimmer, and gardener having a heated discussion as each defends his or her exercise as being the best. We all carry personal prejudices when it comes to your favorite physical activities. However, before being too judgmental, try scoring your favorite activities using 5 categories shown on the table on the right. And I kind of brought it up on the board, which I'm going to go to in a second. For each category, rate your favorite physical activities from 0 to 10. Then add up your scores for all 5 categories to get a composite score. Check your report card to see more objectively how your favorite activities rate. Okay, weightlifting. Let's pick weightlifting. All right, enjoyment. Do you really love doing this activity? Rate it from 0 to 10. Well, I'm going to pick myself. Do I enjoy it? Yes, I do. Okay, I'll put a 10 up there. All right, practicality. How easy, affordable, and convenient is your activity to do? I'll give that a 5. And the reason why I'm going to give it a 5 is because it's not that practical. Because I would have to leave, I have to get dressed, gather all my stuff, go to the gym. I have to pay a subscription, to go to the gym and stuff like that. And depending on the gym I go to, I don't know if the equipment that I need to use is being utilized. So it's not that, the practicality of it. Is it affordable? Yes, it's affordable. Is it convenient, your activity? That's why I'm going to give it a 5. All right, and this is just me. Conditioning effect. How well does your activity do for you physically, emotionally, socially, and intellectually? Well, I'm at the gym. Let's see here. Physically, well, I have to give that a higher score. I'll give that, let's say, I'll say a 10 on that. Emotionally, yeah, I'll give that a 10 as well. Socially, intellectually, I'll give those a 2. So all in all, let's just put an 8. How safe is your activity? Well, it's not as safe as it seems because weightlifting, you have to be very cautious. You got to know what to do, how to do it, and stuff like that because overusing a muscle can actually hurt you. There's a lot of weightlifters that lift and lift and lift and their muscles pull off, meaning they rip their muscles off and it just shrinks all the way up and it's extremely painful. The recovery it takes forever, and even after recovery, you still have that problem a little bit. Is it safety? I'm going to give that a 2. Longevity. Can you do this when you're 80 or 90? Yes, I could. I would have to go very light. Can I do this? I'll give that a 5. Okay, so we're going to pick this. So if I'm at 29 or less, that's a very poor activity. If I'm at 30 to 39, if my tallied up score is around 30 to 39, then basically good but needs room for improvement. If I'm at 40 to 44, that's very good, keep it up. And if you're at 45 to 50, if I'm at 45 to 50, then that's a real keeper. So fantastic, real keeper. So I would tally everything up. So I got 15, okay? And there's 10, so that's 25. Then I got 30. 30, I range right there. Should I change weightlifting to something different? Well, according to this, it's good, but it needs room for improvement. It might not be the greatest exercise for me. So let's pick another exercise. And this is something, it's objective, so it's based off of you, but let's pick running. Okay, running. All right. Enjoyment. Do you enjoy running? Well, I enjoy running, but I hate when I get too out of breath. Okay, let's take the out of breath side out of it. Do you enjoy running? Don't add everything else into it. Do you enjoy it? Yeah, I do actually. As long as the other problems, I got to keep those to the side. Do I enjoy it? Yes, I do. So I'm going to give that a 10 because I actually do enjoy it. I personally, I enjoy it. Practicality, how easy, affordable, and convenient is your activity to do? Well, I mean, I can jog in place, run in place. It's pretty easy. I'm going to have to give that a 10. Would anybody disagree with that? All right, conditioning effect. How well does your activity do for you physically, emotionally, socially, and intellectually? I have to give that a 10 because intellectually, believe it or not, socially and intellectually, when you walk, when you run, and when like jogging, those types of activity, those types of exercises help reduce blood pressure. It helps your lungs. It helps you breathe. It helps your body. If you're depressed, it helps that. You know, it kind of relieves depression. It releases stress. So, I mean, it's just all in all a very good activity. Okay, safety. How safe is it? It's pretty darn safe, I feel. How safe is your activity? Now, remember, if I have injuries in my legs, it might not be safe. But I'm using me currently, you know, of how I feel running and how safe I feel running is. So how I feel how safe running is actually very safe for me because I don't have balance issues. If I have balance issues, my number that I'm going to put a 10 might be lower than that. If I have a leg injury, that could actually exacerbate that pain or, you know, even more increase the injury, you know. So that probably won't be that safe if I had those problems. I have to give this a 10. I do. I'm sorry. I have to give that a 10. Longevity, can you do this when you're 80 or 90? I see a lot of people in my neighborhood that are very elderly and they exercise, they run outside like every morning, you know, and I feel like, and they kind of inspire me because I'm like, I should not be lazy and just get up off my bum and start to run also, you know. But yeah, I would have to say for longevity, can I do this when I'm 80 or 90? Yeah, of course I can. Give that a 10. Of course, all the numbers, 10, 20, 30, 40, 50. Where you at now? Fantastic, a real keeper. But remember, you're using objective references. You're using an objective score chart, you know, to tally up, to kind of quantify how practical, how good is it, how safe, how enjoying is, you know, how do I enjoy it? You're taking that up based off of yourself. If you're somebody that has a lot of problems, you know, and not talking about depression, but I'm talking about problems with maybe anxiety, maybe their legs, maybe their back, you know, those numbers are going to be, of course, different. So you can't just say, oh, swimming is best, running is best, this is better. It's based off of you, what you currently are capable of doing and your overall physical capabilities. You know, some people say, oh, swimming is wonderful. Swimming is the top one. The other person says, I can't swim. Well, then that takes that away, right? So it's based off of the person.